tomir kasalligi bo'ldi, tomirlarda tiqvoq bo'ldi. Biz o'zimizda ko'rindik, davosi bo'lmadi, Qirg'izistonda ko'rindik, Bishkekka bordik, davosi bo'lmadi, bizga qaytarishdi. Keyin O'zbekiston, Rossiya, Qozog'istonga murojaat qildik, ular ham.
We came across a case, Mr Sulyamon, 64-year-old male patient who was referred from Kyrgyzstan. He had a major problem of severe backache which was radiating to the legs, and he had gone to Turkey and they had diagnosed him as abdominal aortic aneurysm and did not do anything. So patient was moving from place to place and he came to me, and then I examined him and did a contrast CT and found out that he had an aortic aneurysm in the abdominal part adjoining both the renal arteries, and this was measuring about 8 centimeters to 6 centimeters lateral to the right renal artery, and it had a neck of about 2 centimeters.
Keldik, hammasiga yana qayta minnatdorchilik bildiraman. O'zim nomimdan, oilam nomidan, xo'jayinim nomidan, qarindosh urug' farzandlarim hammasini nomidan.
And he was discharged from the hospital in a moving condition, walking about, and then he stayed here for 7 days, did a follow-up in the post-operative period. We found that everything was okay, and then it was decided that he should go home.